Maternal Land Child Health Hospital and share with you our experiences. Due to the time limit, I will provide you the slides with some focus. So my topic is about the uterine fibroids and the fertility preservation. Uterine fibroids is the most prevalent myoma in women with high incidence and early mobility. And in China, there are about a lot of patients have mammectomy. For over 200 years, the surgery has transformed from traditional laparotomy to laparoscopic surgery to ultrasound ablation. Development under the guidance of minimally non-invasive concept, it has a non-invasive and influence on the patients. The development is non-invasive and minimally invasive oriented. Over the recent decades, the patients and doctor embrace this kind of treatment. In 2013, our hospital initiated the HIFU treatment. In the beginning, the patients have to be well informed by HIFU compared with the traditional surgery. I have to tell the patients all the knowledge about HIFU. And with the patients without confidence on HIFU, they will choose other surgeries. Decades have passed. The patients come to our hospital to directly ask for HIFU treatment. Changes happened on the way. More and more patients welcome the treatment. The reasons? This treatment is suitable for the requirements of the patients. This treatment in Foshan have been popularized by the installments of the equipment in all the hospitals. For example, other hospitals will imitate our conduct because the patients can enjoy the benefits from HIFU treatment. You know that the purpose of the HIFU treatment is to relieve or eliminate the symptoms and improve the environment. And as for the efficacy, safety, the Professor Zhang have conducted a research in the Queen Mary Hospital in Hong Kong, in the 8 clinical studies on the efficacies, safeties, recurrence, and the recurrence of the myoma or fibroid is a problem confronting all the doctors. My patients ask me, what's the recurrence rate for HIFU treatment and mammectomy? So the principles behind the traditional surgery and HIFU treatment are different. They cannot be compared. According to the study, the recurrence rate is the same to the laparoscopic surgery. So it can reach the level of surgery without invasion or harm to the patient. And as for the multiple fibroid, we can see that the smaller myoma is also stable. However, we find that the small myoma is not increasing. That's because the HIFU treatments have influenced the endometrial environment in the patient. That will prevent the recurrence of the uterine fibroid. As for the fertility, as Professor Li Fang has said, it has influence on the joint junction zone. After HIFU treatment, the most prominent side effect may be the prevalence rate is high, the fertility rate is high. So the patients receiving the HIFU treatment will be pregnant soon after the treatment. So it can improve the fertility of patients with fibroids to a certain extent. So the patients with pregnancy ask me whether she will have the cesarean section after pregnancy. I told her, no, this is not necessary. It will not increase the complications of the pregnancy or delivery. And we have also included HIFU treatment into our textbook. This is our consensus. So this consensus that the first choice for patients with fibroids who have fertility requirements is HIFU. Due to the time limit, I will share with you some submucosal uterine fibroid case. The doctor may sometimes suspect that it will impair the endometrium. A famous doctor said in a conference that the patients have fertility requirement should not have HIFU treatment. And UAE because of the blood supply. However, in my view, according to facts, sometimes the reproduction doctor or doctor will say that HIFU treatment is not suitable for patients with fertility requirements. However, according to my opinion, it is suitable for patients with fertility. This is a fact. But I don't know whether there is a consensus with the reproduction doctors. So how to play this video? I want to show you our treatment in the video. This is submucosal treatment. This is a reduction of blood supply in the uterine. This is a type 2 uterine fibroid. It will protrude into the uterine cavity into a type 1 without electricity. We just use an electrotomy, level by level. I like this feeling. It is fast. It is satisfying without bleeding, with good recovery from the patient. We can use some tools to take out some residues. Some doctors may adopt the laparoscopic surgery. However, with HIFU, to deal with the submucosal uterine fibroid, we can adopt the HIFU with hysteroscopic electrotomy. We can check the uterine cavity by electrotomy with better efficacy. You can see the right picture is the condition in the uterine cavity. So seeing is believing. This is results after ablation. Very beautiful, good looking. So this is a 7 centimeter large type 2 submucosal fibroid, shrunk to 2 centimeters 5 months after surgery. Two pictures, the pre-surgery, and you can see the myoma is very big, a submucosal abnormality. If we use electrotomy directly, there is a high risk. With HIFU, the 5 months after the surgery without follow-up, the patient come back, and we can see only 2 centimeters. Electrotomy was conducted for the 2 centimeters myoma. So inspiration HIFU treatment can significantly reduce the size of myoma and blood supply to the tumor, thus decreasing the difficulty of the surgery, reducing surgical complications, and shortening the treatment period. And the combination of HIFU and hysteroscopy for the treatment of large submucosal fibroids can overcome the limitations of a single tool and enjoys a better efficacy and safety for the treatment. It is best choice for the patients with fertility requirements. And as you all know, it is minimum invasive with minimum harm. Only skin scalding. You can see this is skin scalding. We should pay attention to this. Just relax the skin surface. This is early period incidence. There are only 2 incidents of skin scalding. So this is our new technologies. So with our joint efforts, we can optimize the plan for HIFU from several hours in beginning to 1 hour to treat 5 centimeters myoma, or less than 1 hour. It is optimized. It is progressed with machine, with plan. This is a photo of our center. And welcome to Foshan. Thank you.